What if I told you researchers are working on an injection that can double the lifespan of your cat? Essentially, making the standard issued 9 lives a thing of the past. That's the aim of Dr. Toru Miyazaki. Increasing your cat's lifespan is the aim of every veterinarian out there. That's probably the aim of most cat parents. So in this video, my aim is to chat about the longevity injection for cats. Hi everyone, I'm Dr. Oz. If you are wondering why I keep saying AIM, that is a protein in question. AIM stands for apoptosis inhibitor of macrophages. Since that is a mouthful, let's break that down. Apoptosis is cell death, and not just any death, it is planned cell death of damaged cells in the body, and it's normal. It keeps you healthy by removing cells that are damaged, old, or not needed anymore. A macrophage is a type of white blood cell that is part of the immune system. Just look at this macrophage doing its thing. Oh, it's so beautiful. You go, macrophage, get that bacteria. Sorry. Macrophages help heal damaged tissue, remove pathogens, and remove dead cells. It's part of the body's cleanup crew. For those of you that like big words, phagocytosis, or the process by which a macrophage eats pathogens and old cells. Yum. If you're still with me, AIM, or apoptosis inhibitor of macrophages, then means a protein that prevents the planned cell death of macrophages. In other words, the AIM protein increases the lifespan of a macrophage, allowing the white blood cell to do its job for longer. Early research into this protein seemed to suggest it was linked to fat and lifestyle diseases, playing a role in obesity and liver cancer. But recent research suggests it might play a significant role in kidney disease. Research is looking at the AIM protein and its role with cat kidney disease. There does seem to be a difference between the AIM protein in cats when compared with other species like a human or a dog. The big difference is when the AIM protein binds to IgM, one of the first antibodies to show up in the body when there's an issue, it doesn't let go. This stronghold between the AIM protein and the IgM antibody in cats is the focus of the research. The AIM protein goes wherever it is needed by traveling through the bloodstream. It kind of acts like a flag when it finds dead cells. Once the dead cells are marked with the AIM protein, the macrophage can now see the problem and comes in to help out by eating the dead cell. Further research found that in mice where the AIM protein was lacking, any damage to the kidney typically resulted in kidney failure and death. However, if the AIM protein was injected into these mice, kidney failure and death was avoided. The thought is this: when the kidneys are damaged, dead kidney cells fill up and plug the normal tubes used to filter a cat's blood, which ultimately ends up as urine. And just like with plumbing in your home, if there's a backup, it only leads to more issues until the plug is resolved. Same with cats' kidneys. If the plugs are not cleared, this can lead to more kidney damage, and once the kidney cells are damaged, there's no getting them back. Normally in humans, when waste is present in the body like dead cells, AIM lets go of the IgM complexes in the blood and is filtered by the kidney going from the blood into the urine. While in the urine of the kidney tubes, it flags the dead kidney cells that it finds, and macrophages get the signal to come in to clean up and unclog the kidney tubes, which prevents more kidney damage. Wait. Why don't macrophages eat the IgM antibody since the AIM protein is attached to it? Great question. One thought is that when the AIM protein is attached to the IgM antibody, it is too big for a macrophage to eat, so it is unaffected. Okay, but how does the AIM protein know when waste is present? Here's the current thought. Normally, a cell or protein has a neutral or positive charge on the outside and a negative charge on the inside. When a cell dies or a protein is degraded, that internal negative charge is revealed to the outside. Since opposites attract, the positive part of the AIM protein attaches to the newly exposed negative charge of the waste in the body that needs to be cleaned up. This is a key feature of apoptosis or planned cell death, recognizing dead cells with their negative charge on their surface for removal by phagocytosis with a macrophage. There's a lot more that goes on with cell death and signals for apoptosis, but that is the current running theory. But in the cat, AIM doesn't separate from the antibodies. It is so tightly bound to IgM antibodies, it is not filtered by the kidney, it does not enter the urine as much, it does not attach to dead kidney cells as much, and macrophages do not clean up the plugged kidney tubes, which results in more kidney damage when compared with other species. Essentially, AIM is not doing its job in a cat. The goal is to inject AIM or activate AIM in the body to help protect the kidneys. In theory, if you can increase the AIM protein in the urine, especially during acute kidney damage, you could potentially clear out the dead kidney cells with the help of macrophages and potentially avoid any further kidney damage. Saving the kidneys as much as possible potentially will result in more years with your cat. It appears that cats, for whatever reason, have difficulty utilizing this protein, especially when compared with other species like us humans. So in theory, there is a potential to accelerate this normal process that naturally occurs in the body to help cats with kidney disease. But the question remains, why is the AIM protein activity different in cats when compared with other species? Cats are known to do whatever they want and do things differently. So, will activating the AIM protein actually benefit cats or cause another issue? Before you get too excited, that is a lot to unpack, and we have so many questions we aren't even close to answering. Unfortunately, when someone says double your cat's life expectancy, people perk up and start to take notice. For me, this is way too early to even think if this will be a reality or not, let alone live up to the hype that it'll increase a cat's lifespan to 30 years. However, possible routes of administration that are being talked about in research include an AIM protein injection and a cat food. One approach would be to develop an injection that would increase AIM protein in the body and prolong a cat's life. Word has it that clinical trials are currently evaluating a vaccine that would do just that. Another approach is cat food. Pet food manufacturers are looking into ingredients that would help separate the AIM protein from IgM, making it more available to cats with kidney disease. Word has it this diet is called AIM30. Getting a little more specific, it has been found that at certain levels, the amino acid L-cysteine can help separate the AIM protein from the IgM antibody. One of the goals with this diet is to help the kidneys before their values increase on standard blood tests by cleaning out their tubes that may be plugged with dead kidney cells. Remember, 75% of both kidneys are not working before the standard kidney value creatinine becomes elevated on routine screening panels. And creatinine is a waste product in the body. It comes from the breakdown of muscle, so other factors might increase creatinine not related to the kidneys, like overall muscle mass of a cat, diet, and hydration status. Not the best test in the world. A newer test, SDMA, can help pick up kidney disease earlier, potentially when 40% of both kidneys are not functioning. And there are lots of unanswered questions around this AIM protein, like, when do we start giving injections? How often do we give injections? Who can give the injections? How much do they cost? What happens if you stop or miss an injection? Are there any side effects? Does it interact with any other medications? How do we know it is working? Can this be used for Lily or NSAID exposure in a cat? If this pans out, the really big question is, does it have implications for human health care? We are already looking into an HIV vaccine for humans by studying FIV virus in cats because those viruses are so similar. The same might be true for the AIM protein injection, potentially treating patients with liver disease, rheumatoid arthritis, stones in the urinary tract, and patients that have suffered from a stroke. Will this be a cure for cat kidney disease? Only time will tell, and 2027 is the earliest this injection might be available. If I can be real for a moment, I really hope this works, but I'm a realistic vet working in the real world with a healthy dose of common sense. Kidney disease is a complex disease process. We really don't know what causes kidney disease in cats, and there are probably many factors that contribute to the disease in cats. There is no cure, only management and slowing the progression of the disease. The likelihood an injection will clear up dead cells in the kidney and double your cat's life expectancy is sounding a little too good to be true. But I love being proven wrong. Let's say this actually works. The longer any of us live, the more likely other issues may arise. My big four old cat diseases are kidney disease, thyroid disease, diabetes, and inflammatory bowel disease. Let's say kidney disease is taken off the plate. The longer a cat lives, the more likely they will get one of the other three diseases. And don't forget about the bad C word. You know, cancer. The risk increases with age. And while this treatment can help the estimated 40% of cats over the age of 10 and 80% of cats over the age of 15 affected with kidney disease, it will likely do nothing for any other disease your cat will get as they age that will negatively impact how many years your cat will live. And I say this on the heels of a commercially available FIP treatment, a disease that was 100% fatal just a few years ago. Now, most cats are responding to treatment and we are saving so many lives, something I never thought possible in my lifetime. So while doubling a cat's life expectancy seems a bit far-fetched, extending cats' lives by a few years seems much more realistic with this research. I doubt it's going to help every cat that is affected with chronic kidney disease, but prove me wrong, AIM injection and AIM diet. I will happily rejoice and celebrate more years with our feline family members. And prove me wrong, Dr. Teru Miyazaki. Hopefully I'm pronouncing your name right. If you are correct, the cat population as a whole will be forever grateful. Even though cats will never admit it. It's not you, it's a cat thing. If you're excited and motivated, well then check out the Institute for AIM Medicine, a nonprofit research institute founded by Dr. Teru Miyazaki to help develop treatments for diseases relating to the apoptosis inhibitor of macrophages protein. The link is in the description. If you enjoyed this video, like, subscribe, and comment. Do you have a topic you'd like me to chat about? Well then drop it in the comment section. As always, thank you so much for watching and I will see you on my next video.